How to monitor the heart? We have the 3 lead monitoring, 5 lead monitoring, 12 lead monitoring, quick look paddles, hands-free adhesive pads, Holter monitoring, event recorder, loop recorder, and EPS. These are different ways to monitor the heart, the electrical activity of the heart. There is no restriction for the food or the fluids. Maybe if somebody eats ice cream or drinks very cold drink before the ECG, it may make some changes in the T wave. Exercise ECG just before the ECG may increase the heart rate. It's better that the patient remove all the jewelries, all the metals, and wear a hospital gown, and make sure that the patient is taking or not taking medications because they can alter the ECG parameters. So typically you ask the patient to lie down. Electrodes are fixed to the arms and to the legs, and to the chest, sometimes in the back, as you will see. Some people, they have too much of hair, so you need to remove this hair if the leads are not connecting well. And the number of leads attached, electrodes attached, can be 12 up to 15 or 16, and it can be as less as 3. Regarding 3 leads monitoring, we can see here that the connections are where? Right shoulder, left shoulder, symphysis pubis. But it's not actually in the symphysis pubis. We connect it to the left subcostal margin. Why in these areas? Because we want the attachment to be on bones, not on muscles. If you attach to muscle and the patient moves or something, you get artifacts. But on bones, most probably you will not get artifacts. So you want it to be on the bone, here, and the costal margin here. What should be the arrangement of the colors? They are color coded. So we have red, yellow, black, green. Which one you will put where?
The red on the right. And
red on the right.
Yellow.
Mm-hmm. Yellow on the left. Okay.
Yeah. Green and the
green on the spleen. All right. So red for right, yellow for left, green on the spleen. All right. So this is one way to analyze the rhythm. And of course, this 3 leads monitoring, you can display 1 lead minimum. So usually on the monitor in the emergency, you will find the display is showing only 1 lead, and there is a button to change the lead displayed from lead 1 to lead 2 to lead 3. So it's color coded. You need to remove the hair and apply over bone, not the muscle. For the 5 leads monitoring, you will do the same thing, but you will need to put another one at this side. Usually it's black, so opposite to this side. And another one in the sternum, this will be white. This is 5 leads monitoring. What are they doing to the patient? Shock. Yeah. Actually, the pedals of the defibrillator, they can work by monitoring or shocking. So they give shocks, yes, but if you use the defibrillator and put it on the chest of the patient and move the cursor, and instead of the jewels, you put it only on monitor, and the connection is through the pedals, not through the ECG. So you connect the pedals, you put the pedals on the patient, you monitor the ECG, you monitor the heart. So why do we call it quick look pedals? Imagine now that you are in the recess, and just now they brought for you a patient from the ambulance. He is unconscious, looks like cardiac arrest. You put him in the bed, and then you want to know the rhythm. You are continuing the BLS. The rhythm is the one that will make you transfer from BLS to SLS. So you want to to attach the patient to the monitor. So what to do? Bring the ECG technician or the nurse will do it. Clean the chest, remove the hair, attach the electrodes, and then see the rhythm. Okay, rhythm is VF. Let's give a shock. All right. So you will clear everybody, adjust the jewels, and take the paddles on the chest of the patient, charge, then shock. Yeah. With quick loop paddles, if you don't have the adhesive pads actually, so with quick loop paddles, you just put the patient on the bed, take the defibrillator, make it on monitor, and put it on the chest of the patient. VF. Okay, ask somebody to change the joules, 200 joules, shock. Quick. So this is faster. This is to help the patient more. Yeah, not to consume time. What is the problem with this?
Somebody has to hold it in place.
Exactly. Somebody has to be standing there. So you will lose one member, one team member, just standing frozen on the chest of the patient to analyze. So during this this quick loop paddles, he's putting his hand like this, and another patient is trying to do the compression. So it is hard to manipulate. That's why we have now this one. What is it called?
It has pads.
Adhesive pads, hands-free adhesive pads, another name, multifunctional pads. Why do they call it multifunctional pads? They do three things. Monitoring,
Shock.
it delivers shock, and it paces also. All right, so it's multifunctional pad. Easily adheres to the chest of the patient. If the patient has too much hair, you need to remove it quickly. Some people, they think, okay, if it is too much hair, stick one, remove the hair, throw it, put another one, and with this new one you will analyze. Yeah, some people think like this. But actually, because we are here in Dubai, this one is very expensive. In Egypt, in my country, it costs 750 Egyptian pounds. So just to waste it, just to remove the hair, it's really very bad. So appreciate this is very expensive, but it's very effective also. So it's hands-free, no need to be frozen on the chest of the patient, but it's very expensive. Regarding expensive, who wants to buy this car? There is a nice offer. Anybody wants to buy it? Interesting. Actually, I will if I know what is the deal. So I don't want to see from one view only. I want to see from the right side, left side, from inside, outside. Yeah. So yes, I can get a small opinion about the car from one side, but I need to see the whole situation. Same thing that 12 leads ECG, it will give me a 3D view about the heart. So I'm surrounding the heart from all the sides, from top, from down, from front. I can check it from back, as we will see. In the rhythm strip lead, in the leads in the monitor, I cannot analyze the ST segment. If you, for example, if you are in the recess and you find in the monitor, the patient develops ST elevation in their monitor. Will you give thrombolysis? Will you decide something? We cannot. We have to start with first doing 12 lead ECG, and then analyze it, and according to the 12 lead ECG, we are going to treat the patient. Just one problem with the 12 lead ECG, that it's a little more sophisticated, but inshallah we'll make it easy. Alright. So this is how to monitor the heart. These are the chest leads that we use, and all of the chest leads are unipolar. Only the limb leads, you can use them as bipolar, lead 1 to 3, AVR, lead 1 to 3. And you can use the limb leads also as unipolar, as AVR, AVL, AVF. Chest leads, they are arranged from V1 to V6 as you can see. You can also view the right ventricle by changing the location of the ECG electrodes. So just instead of doing them in this direction, make it the other way around, like this. And the right ventricle is located here. So if you do an X-ray and you imagine the X-rays there, vertebral column is in the center, heart shadow is in the left, but there is little cardiac shadow on the right side. So on the right side here you can see the right ventricle, and we usually focus on V4, V5, V6 to analyze the right ventricular electrode. You can also do posterior ECG to analyze the posterior wall infarction. So just that when you reach here the V6, you continue to backwards like V7, V8, V9. So in the same location of 6, you continue backward to the vertebral column. Alright, so how many leads so far? 2, 4, 6, 10, 3, 3, so it can reach up to 16. Alright, so regarding attaching the 12 leads ECG, you need now to attach the limb leads. How are you going to arrange them? Again, same like the 3 leads monitoring, right upper is red, left is yellow. Instead of green on spleen, you put the green down on the left lower foot, and the remaining one is ground connection is
Black.
the black. Or if you love dates, if you like to eat dates, imagine that the date is growing on the tree. First it will start green, it will ripe little more, becomes yellow, little and little more red, and if you leave it till it ripes a lot, it becomes black. So like this with the dates. Alright.